Hello everyone, I'm Dave, and today I'm going to talk about bone marrow biopsy. I've had 4 bone marrow biopsies to check the bone marrow to see if my cancer has spread into the marrow. I have multiple myeloma, which is a type of cancer that attacks the bone, and sometimes it spreads into the marrow, sometimes it does not. All 4 of my bone marrow biopsies have shown that the marrow is not infected with cancer, fortunately. When I first heard that I had to have a bone marrow biopsy, I was kind of nervous. It sounds scary. They have to go inside of your bone. I thought they'd be using a drill. They don't actually use a drill, they use some kind of needle. If you're watching this video, you probably want to know what it's going to be like, or you'd like to know what someone you know is going to go through. From my experience, the bone marrow biopsy was not as bad as I thought, but it is one of the more uncomfortable, more invasive procedures that you're going to have to go through. You're probably going to do blood draws all the time. You get used to those. You're probably going to have MRIs. You get used to those. You probably have PET CT scans, other types of x-rays, things like that. You're going to get scanned a lot. But the bone marrow biopsy is the most uncomfortable of all of those. It's stressful and it feels bad. But overall, it's better not to be scared about it because it's not as bad as a surgery. Considering the things that we go through, surgeries are pretty extreme, and a bone marrow biopsy is not like that. It's uncomfortable, it's unpleasant, and as I said, it's one of the worst things you're going to have to do, but it's not as bad as a surgery. And as long as it's not as bad as a surgery, we can get through it. I've done this in 4 different places, and each place had their own way of doing it. One place it kind of was like a surgery, not the procedure. The procedure was the same, but the way they treated me before. They had me in a bed, they didn't want me standing, they would lift me and move me to the other bed, they were rolling me down hallways, they took me into a big room with a lot of people. Everybody was working on it and saying my name and stuff over top of each other. It felt very professional. Another place I did this, it was just one person, took me into a room and did the whole thing by herself. I think a good baseline would be to explain the way it's happening at my current hospital. In my current hospital, it's an outpatient procedure, of course, it always is. So they had a nurse who took me into a room, not a surgery room, more like a consultation room. They laid me out on the bed, face down. I didn't have to disrobe. I had to pull my pants down because they're checking my hip bones and my sacrum and my back. So I had to pull my pants down. I laid on the table, still wearing my shirt, still wearing my hat and glasses. The nurse is going to clean the area and get me ready for the other people to come in. The person who came in to actually do the bone marrow biopsy was some kind of bone marrow biopsy specialist. And she's the one who really got everything happening. She put tape on me and covered my back with stuff. And here's the thing about my bone marrow biopsies. I can't see it. It's all behind me. They're talking, they're moving things. I can hear paper ripping open. I can hear things moving around. When you hear that metal tray clacking, you know that there's instruments on it and you hear that rattle coming towards you. That's a little nerve-wracking. Overall, they're moving fast, they're doing their job, they're checking in with me a little bit, but they're not really talking a whole lot about what they're doing. They're going to numb the area around where they're going in. That's going to hurt. The needle goes in kind of far. It doesn't feel good. It's much more than a pinch. It's like cutting yourself. You feel it. Then a lot of the pain goes away because that's the numbing agent. And now they're going to start putting in other things. So here's the part that's really going to get your nerves. They have something, I don't know what it looks like. It sounds like a slide hammer. You can hear metal pieces sliding on each other. They sound like metal tubes. They're going to start pushing this thing into the body and then into the bone. You can feel it going in. There'll be a little bit of pain, pinches deep, deep inside. It can't be avoided. You're going to feel some of this. Then when they get to the right spot, she's going to start using that slide hammer piece. And you're going to hear the sliding metal and the clank of it hitting. Clank. Clank as it's being driven into your bone. I'm too afraid to look back. I'm too afraid to ask what the instrument looks like. Now I kind of wish I knew because it might tone down my fears. It's very unpleasant. It's going to hurt in a way that you don't recognize. It's kind of like the pain of getting a needle, which, isn't too bad, but imagine that pain inside your bone. It's a psychological thing. It's freaking me out because I don't really know these feelings. These are new things to me, and it might be for you as well. At my current hospital, they ask me if I'd like to listen to music. They've told me this is because they want to drown out the sounds. Most people do that. I said no because I I kind of want to know what's happening. It's less scary if I know what's happening. But in this case, it's really not less scary knowing what's happening. It's going to be uncomfortable. There's going to be moments where you're just bearing the pain. You're just trying not to move. You're just trying not to freak out. It's not the pain that's going to make you freak out. It's knowing that the pain is there, knowing what they're doing, feeling your body move as that slide thing is coming down and driving further into your bone. The pain is enough that you're going to try to concentrate on other things. You're going to try to think of stuff to take your mind off of it. There is a moment in there, and it felt like a minute, maybe 2 minutes. It's probably more like 20 or 30 seconds where it's just a lot. There's a whole lot happening. There's a whole lot you're feeling. You know what's going on back there. It's really stressful and it hurts. But when it's over and they pull all the instruments out and they have their sample, the pain all goes away. All of that's just done. It's surprising because you can feel it in your bone that it doesn't hurt too bad. And that's it. When I got my last one, the mental effort of just not focusing on the pain, not being scared, was quite an effort. I was actually thinking about the view. When I came into the hospital, I looked at the view out the window, pretty trees and mountains and stuff. I was focusing on that view. It was a recent memory and it was a pleasant memory, and I was just like looking at those hills in my mind. That's all I could do. It didn't really work that well, but I did my best. I would say go in there with something to think about that can help you take your mind off of it while it's happening. If you're into music, it's probably a good idea. Now, in the aftermath of this, they're going to put a waterproof bandage on there, a compression bandage. They don't want you to leak out. They don't want you to bleed too much. You have to keep it on for a day or two, and then you're allowed to peel it away and wash the spot. It's going to be sore, but not too bad. The recovery is really not a big deal. There's going to be a bump there, and it's going to take a while for that to go away, but it does go away. It took about a month for me before I couldn't feel it anymore. And that's it. That's how it goes. It is something to prepare for. Just mentally be ready for something very unpleasant. We go through unpleasant things all the time. We have to bear them. It's just the life of a cancer patient. This is not one of the worst things. It's just one of the worst things you're going to have to do that's not surgery. I hope this doesn't make you scared. It's not supposed to sound scary. It's supposed to give you the idea of what you can prepare for and how you can just be ready. It's unpleasant, but you can get through it. I hope this explanation is helpful for you in some way. Thank you for watching. Farewell.